Um, okay, recording in progress. Good evening, everyone. Welcome to our webinar. I would like to start with an acknowledgement of country. APEC would like to recognise the traditional owners of the different lands we all work on and attend from today, and the First Nations peoples present in this webinar. We pay our respects to all elders past and present, and acknowledge and celebrate the diversity of First Nations peoples, their culture, connections to the country and waters. So my name is Heike Roth. I am the midwifery advisor for APEC. I'm currently in my third term, and I'll be your host for tonight's webinar. I'd also like to, whilst I'm at the admin bits, I'd like to introduce Cami. Cami, do you want to say hi? Cami's our APEC secretary. She's been with APEC also for about 3 terms now, and recently completed her medical degree. And so we're very grateful she's assisting us with all our important webinar related activities, background stuff in preparation of today and also tonight. So thank you so much, Cami. Everyone who is attending and who's registered and sent in questions we're very grateful. Thank you. We'll be recording tonight's webinar, and we'll upload everything onto our website for you to review and share with your family and friends at a later stage whenever you would like to revisit that. Also throughout the session, if there are any further questions, and if we've got time for these, obviously you may use the Q&A, is that correct, Cami, or the chat, for you to post any questions, I believe, anonymously. And I guess the aim of today's webinar is to answer the questions that you've thus far submitted to us via our social media and when registering for tonight's webinar. And whilst we'd like to answer these questions, as APEC, we'd like to caution everyone that the information we share here needs to be taken on board as general information. Your GP or specialist healthcare provider will be the best place to provide you with more tailored health-related planning and discussions, as they'll consider obviously your personal health context and address your specific medical needs and preferences. So I think we all know APEC. You are generally members, those are participating. But our objectives, basically, it's a volunteer-run charity, and we aim to educate, inform and advise the public and health professionals as well, obviously, about the prevalence, nature and risks of preeclampsia. We also like to support women and the families who experience preeclampsia. We also tend to campaign for wider awareness on the topic and support research, whether it be on prediction, diagnosis or management of the care. So without further ado, we've had little intros. I'd like you to please meet our amazing panelists who are on our panel tonight. I will let them each give a brief intro, and I will start with Dr. Lynne Roberts, who's also the president of APEC and a registered midwife. Good evening, Dr. Lynne.
Thank you, Dr. Heike. As Heike said, I am the president of APEC. I've been in that position for just over 2 years now. This is my 3rd term, although I have been involved with APEC for a bit over 31 years now. I joined shortly after it was established, after I had preeclampsia myself and gave birth to my son at 30 weeks of gestation. I reached out to APEC then for some support, and I've been a member ever since, and I've had various committee roles along the way. And yes, like I said, I've been president for the last couple of years. As Heike said, I am a registered midwife, and I currently work in the field of research looking at long-term health after having a high blood pressure in pregnancy. And I'm really excited to be here today to answer the questions.
Thank you, Lynne, and welcome. Next on my list, I've got Professor Amanda Henry. She is the medical advisor for APEC. And welcome, Amanda. Would you like to give us a little intro?
Thanks, Heike. Yeah, so I'm an academic obstetrician based in Sydney, St George Public Hospital with Lynne, and I've had the great pleasure for, gosh, close to 15 years now of working with the Obstetric Medicine Research Group at St George Hospital, and including having Priya, Vakil, and Cami as wonderful medical students doing research projects with us. My area of research focus is around pregnancy complications like preeclampsia and how they affect women's health across the life course, and about doing whatever we can to prevent chronic disease after pregnancy complications. And I also had the very great pleasure of supervising Heike doing her PhD in this area. So, yeah,
I'm
thanks.
very lucky I was. Thank you and welcome. Next, I've got Siphiwe. She's one of our general members and consumers. Siphiwe, good evening. Would you like to give us a little bit of an intro?
Yeah, sure. My name is Siphiwe, and I'm currently in Perth, Western Australia, and got to know APEC through experience. Mum who's had two beautiful boys, but both of them were as a result of early pregnancy as a result of preeclampsia. So here to share my lived experience as a mum of two boys who delivered them early due to preeclampsia. And my passion is just to raise that awareness and give that support where I can that through the lived experience that I've had. Thanks.
Thank you and welcome. I've got next on my list Dr. Priya Vakil. Good evening. Would you like to give us a little bit of an intro?
Hello everyone, my name is Priya. I'm a junior doctor working here in Sydney. I first was involved with APEC during my studies as a medical student, where I worked with the Obstetric Medicine Research Group at St George, looking at the growth and developmental outcomes of kids who had parents with preeclamptic pregnancies. So I'm really excited to be here today to help answer your questions from a medical perspective, obviously with the help of Prof. Henry, and we're really excited to be able to share our knowledge of preeclampsia with you.
Thank you and welcome. So yeah, welcome everyone. We'll get launched straight into the questions. We've got about an hour together, about 50 minutes left of that. And we've got some interesting questions that have been posted. So hopefully we'll get through them all. We'll try our best. I'll try my best to moderate everyone, not to cut anyone off too harshly. I'll direct some of the questions. I've kind of grouped them a little bit, and what I'll do is I'll direct them to some of the panelists, but obviously if someone is feeling strongly about adding further comment to that question, please, let us know. Right, so the first question sort of segment of questions is about subsequent pregnancies after having experienced preeclampsia first time. So the question sent in was, what are the risks for a mother in her second pregnancy after severe preeclampsia and complications in her first pregnancy? And I'd like to direct that one to Amanda, please.
Yep, thanks, Heike. So there's not a single answer to that question. So it does depend a little bit by what we mean by severe preeclampsia. It does depend a little bit by what we mean by complications. And it also matters in terms of women's other underlying health factors. So in terms of just kind of all comers, so if you've had preeclampsia at any stage in a first pregnancy, then most women will still not get preeclampsia or any kind of high blood pressure in a second pregnancy, but the risk is a lot higher than if you had an uncomplicated first pregnancy. So about 1 in 4 women who've had preeclampsia in a first pregnancy will get high blood pressure again. About half the time that's just high blood pressure, and about half the time, so about 1 in 8 women with a second pregnancy will get actual sort of preeclampsia, the multisystem disorder again. Now, the things that kind of moderate that risk are, as I said, sort of what happened in the first pregnancy. So the earlier the onset of preeclampsia, the higher the chance that it will happen again. Although it is often later in onset, if it does happen again and not as clinically severe. And if mums have other underlying risk factors that increase their chance of high blood pressure problems, such as having diabetes or chronic high blood pressure or underlying kidney disease, or certain autoimmune disorders, then that does increase. But even the sort of the highest risk mums the second time around, it's not more than about 50-50 chance, which obviously is still scary if you've had a bad experience the first time. But yeah, it's certainly not inevitable. And there are things we can do to try and decrease the chances as well.
Okay, thank you. Very comprehensive answer, which covers one of the other questions, which was more sort of around having a third pregnancy. But I think your response covered that. A further question, and I'd like to direct this to Siphiwe, maybe also Lynne, as having experience. You've had lived experience of preeclampsia. So the question is, I had preeclampsia with my first. We are trying to conceive a second child. What is the journey like the second time around? For example, like as a high risk pregnancy, what sort of care should I expect? I don't know if maybe Siphiwe would like to start.
Sure. Yeah, from my experience, I experienced more care. And I would say if you're going to the same GP or your GP knows your history, they will be monitoring you from the beginning. So with my second pregnancy, they were monitoring my blood pressure more closely, and I was put on aspirin quite early when there was just a little bit of spike in my blood pressure. So you should expect more care. And I remember being referred to, in WA, we've got a specialized hospital, King Edward Memorial Hospital for Women. And that's where I was referred to pretty early. And there at the hospital, there was a team that was actually looking after me, regular appointments. And depending on your pregnancy and how you're tracking along, that will also vary. That will determine how often you're going to the hospital, how often they need to check up on you. And unfortunately with me, my blood pressure was increasing. So as it was increasing, they were giving me medication and seeing how I was responding to that. And I found it thorough because every appointment that I went, they were also doing my blood work. So it was testing urine, looking at my blood work, how, my platelets and everything else. So it's a more precise care, I guess, because they know your history and they're monitoring you all the way through. So I even found that as I was progressing along, the hospital visits were more often versus, from fortnightly to by the time I was admitted, it was like every other day. I was going for that regular blood pressure check, blood, urine, and all the work. So I'd say you will expect more hands-on and care from both the team that will be looking after you.
Yeah. How about Lynne, if you got anything you'd like to add to the experience?
Well, I totally agree with what Siphiwe has said. My experience with my second pregnancy after having preeclampsia was an extremely stressful time, constantly worried about whether it was going to happen again. But what I was reassured with was that the doctors and the midwives who were caring for me knew my history, and I felt that them knowing what had happened in the past, and they were very cautious about my care and very thorough in the monitoring. I found that quite reassuring. And like Siphiwe's mentioned before, there's definitely increased frequency of your checkups and blood tests and ultrasounds and blood pressure checks. And taking aspirin is something that all women should be doing after they've had a hypertensive pregnancy too. One thing I think that really helps is for you to be fully informed and have a good understanding of what preeclampsia is and what to look out for. So if you seem to be a bit more in tune with your body second time round, knowing more about preeclampsia. So just don't be afraid to contact your doctor or midwife or hospital if you're just not feeling right. Trust that gut instinct, because you could be on to a good thing there.
Yeah, thank you. I just wanted to sort of add maybe a medical perspective. So I don't know if Priya, what's your perspective in terms of, coming from the medical sort of side of care? Anything that you'd like to add, what that looks like for you? Also, working with women and families that are going through this the second time, even the first time, what are some sort of considerations that you would like to share with
I
us?
think Lynne and Siphiwe covered it pretty well. It is just a state of increased monitoring. So from the first antenatal visit, as soon as you find out you're pregnant, all the way to delivery and even postpartum care, there is an increased monitoring. So taking a detailed past medical history, again with your GP and your just like your pregnancy health provider, screening for other conditions that can worsen or preeclampsia or be associated with poorer health outcomes, such as like diabetes and other complications of preeclampsia. I guess we ask more targeted questions, and I guess it's fantastic in a way that both the patient and your family and the healthcare provider are all sort of more hyper aware of symptoms and more regular monitoring per se. So, all throughout pregnancy, whether it's with scans, whether it's with biochemical tests, or whether it's with just a monitoring of symptoms, home blood pressure monitoring, all that sort of thing, we basically just have increased monitoring of it, as these guys mentioned before.
Thank you. Now, you've alluded to it a little bit, Amanda, before, and also Lynne. This next question is more sort of about sort of prevention. My first baby was born at 32 weeks due to preeclampsia. We're thinking about having another baby. Is there anything we can do to prevent me from having preeclampsia again? You mentioned some of those preventive things women can do with medications and increased monitoring. Anything that you can maybe talk a little bit more detailed about those preventive measures?
For sure. So the first thing I think is, having a pre-pregnancy checkup so that various sort of other chronic conditions that might increase the chances of preeclampsia happening again or just increase the chance of complications in pregnancy are picked up and controlled as best as possible. So, checking that there's no evidence of chronic high blood pressure, and if there is, that is, well controlled before you embark on the next pregnancy, or other medical conditions, like diabetes, check that that's not that. And then, of course, into pregnancy, all women should make sure that they're up to date with all the simple stuff. This is not to do with preeclampsia, but if you do your cervical screening test, make sure that's done. If you do any vaccinations, make sure that's all kind of up to date. And then the usual preconception health, like the pre-pregnancy folate containing, multivitamins before you're getting pregnant. So then once you get that good news positive pregnancy test, then making sure initially you're seeing your GP for, your routine screening tests, probably a dating ultrasound, checking everything initially is going okay, and then referral to the pregnancy services, which, yes, will be the high-risk pregnancy services at your local hospital. And then during the pregnancy, essentially, we've got the 3 pillars of prevention, and they are aspirin, calcium, and exercise. Aspirin decreases. Oh, thank you, Cami. So here's the SOMANTS little infographic about aspirin in pregnancy, and essentially, particularly sort of early onset preeclampsia, so preterm preeclampsia can be reduced by more than half with the optimal use of aspirin. So starting probably any time from about 10 weeks, but before 16 weeks, and a half 300 aspirin at night. And you don't keep the half for the next night. You just throw away the other half, and just try and get into a routine. So, having it by the bedside, for example, to take just before you go to bed. Calcium is most useful in women who don't have sufficient dietary calcium. The SOMATS guidelines actually do have a little link to a calculator where you can work out what your dietary calcium is and whether supplemental calcium is likely to be helpful for you. But in women who don't quite get enough dietary calcium, again, can reduce the chances by a third to a half of preeclampsia. And then exercise, which is a great idea anyway, and also decreases the chances of things like diabetes of pregnancy, not just high blood pressure. And my little mantra for everybody is you don't have to take it seriously just regularly. So you don't have to be, training for the Sydney Marathon or whatever it might be. It's just, regular aerobic exercise, half hour a day if you can. Those are the three pillars of prevention.
Perfect, thank you. The next question is a bit more about what to do during pregnancy, how to look after oneself. I guess what is important for me to do during pregnancy? How can I make sure I look after myself and my baby if I'm diagnosed with a high blood pressure problem? I'm thinking maybe Lynne, as from a midwifery perspective, and if Amanda or Priya would like to chime in with the medical perspective.
Yep, happy to do that. The first thing I'd say is learn as much as you can about having high blood pressure in pregnancy so that you are fully informed. The next thing, and it's really important, is never miss an appointment for a checkup. Never miss an opportunity to have your blood pressure checked or your urine checked. Your blood's checked if you need to. So if something happens and you can't make an appointment, it's really important to reschedule that as soon as you can. Another important thing is to make sure that you continue taking your medication as prescribed, particularly the aspirin if you're taking that, the calcium. If you are commenced on any medication to help control your blood pressure, it's really important to continue that as prescribed. Because it may help prolong your pregnancy, and it will certainly help control your blood pressure and keep it at a more normal level. And the other thing is to be very aware of what to look out for if the symptoms of preeclampsia are coming on or getting worse for you. You need to know about them so you know when to ring your healthcare provider or your hospital. So we're talking things like if you've got a severe headache that won't go away with some Panadol, or if you've got a pain under your right ribs, or your vision's a bit funny, it's a bit blurry, or you're seeing spots or stars, or if you're just not feeling right, these are all signs that you may have preeclampsia or it may be getting worse. So just know when to contact your healthcare provider for some help. And I'll let Amanda take over for the other side.
Anything you'd like to add?
Oh, look, I think Lynne's been pretty comprehensive. I definitely want to reinforce in terms of, trying to make your appointments and, making sure you reschedule if for whatever reason you can't make something. There'll usually be more intensive baby monitoring as well with high blood pressure, so growth scans, and we will organise those for you. I think another thing to say is about, if you're started on high blood pressure medications, we have had rolling issues with supply and access to antihypertensive medications for women who aren't ill enough to need to be in hospital but are trying to get them in the community. And if you're having trouble at pharmacy, either because pharmacists, through lack of understanding, are reluctant to give you your medication, or because they can't find it for you, don't sit at home waiting and worrying about it. Please get straight back in touch with your hospital and your care providers, so that we can sort that for you.
Okay, good point.
And mental health, I think, is another really important, thing to emphasise. And, your care team at the hospital, or, if you've got a good relationship with your GP, maybe, you've had some mental health issues in the past, whoever you trust in terms of seeing and support. And but don't underestimate, obviously, the impacts on yourself and your partner. Yeah.
Stressful time, as both Siphiwe and Lynne mentioned, as having the lived experience. Next question is about IVF. And is there an increased risk for women undergoing IVF if they have had preeclampsia or severe preeclampsia in the past?
Okay, so yeah, I feel like I'm talking a lot. Look, there are some increased risks of preeclampsia with IVF, and that's actually just generally. So it's not one of the sort of the high risk factors for getting preeclampsia, but it is in the SOMAT's table of moderate risk factors. So, increases things by kind of a couple of times. So to be honest, if you've kind of had preeclampsia before, it's much more the fact that you've had preeclampsia before that's the increased chance, rather than whether you IVF or not. But yes, IVF does modestly increase the chances. If it's IVF with your own eggs and sperm, then that is less of a risk. Things like donor sperm, and in particular donor eggs, with IVF does, because of immunological factors, does increase the preeclampsia chances a bit more. But mostly it's modest with the IVF, and it is more to do with the fact that you've had preeclampsia before. But all the again, the pillars of prevention all still work just as well.
Yeah, which was sort of the second half of the question. Is there anything that can be done to reduce the risk? And I think you've covered that well. And this, there wouldn't be anything additional to do that. Yeah. Okay. Thank you. And next question is a little bit, again, quite specific. Do blood clotting conditions such as Leyden factor 5 increase risk of hypertensive disorders of pregnancy? And Amanda or Priya,
so again, this is in the sort of SOMAT's guidelines. So some things, yes, not Leyden factor 5, and most of the what's called thrombophilias that are often tested for in sort of fertility treatment really have no impact on the risk of preeclampsia. But the autoimmune condition lupus, or SLE, as it's sometimes referred to, that does moderately increase the risk of preeclampsia. And there's also another disorder, antiphospholipid syndrome, which is associated with clots, as well as preeclampsia. So there are a couple of very specific ones, but by and large, no. Yeah.
Okay. Thank you. I might direct the next question to Priya. When does the blood pressure settle after preeclampsia?
Yeah, so actually the definitive management of preeclampsia is birth of the baby. The blood pressure can persist postpartum. Typically, the first 72 hours, we closely monitor women in hospital, and that can often delay discharge a bit because we want to make sure the blood pressure is well controlled. Often women will be discharged on antihypertensive medications, but generally most blood pressures will reduce within the first sort of 4 to 6 weeks. Of course, this is very dependent on factors such as the severity of preeclampsia, how early onset in the pregnancy it was detected, if there were any other complications, including any damage to the kidneys or anything else like that, which again sort of ties into the severity, and also other factors not associated with the pregnancy, such as mum's cardiovascular health coming into the pregnancy itself. So of course, there's going to be strict and careful close postpartum monitoring of women who have had preeclampsia to help see that blood pressure can downtrend, and that can be with a specialist or with the GP. And if there is sort of a persistent elevated blood pressure at around that 4 to 6 week mark, then potentially that it could be we can start thinking about more long-term blood pressure managing medications, and even referral to back to the obstetrician or gynecologist or even a cardiologist for further investigation of that. And we do know that preeclampsia does increase mum's risk of having cardiovascular disease in the future. So it is really important to monitor the blood pressure closely. But for most people, around 4 to 6 weeks.
Thank you. I'll continue on with Priya. There's a couple of questions about how preeclampsia affects the child of that pregnancy. So does having preeclampsia affect the health of my child? If so, in what ways?
Yeah, so this is a really interesting area because preeclampsia affects both baby intrauterine, during the pregnancy, as well as there's more research coming out of effects on the child in the long term. Again, depending on the severity and sort of the onset or what week of gestation that the preeclampsia is discovered and then treated. I guess the early risks more to do with preterm birth, because as I mentioned before, the only definitive treatment of preeclampsia is delivery. So often in women who the blood pressure is rising or we're worried about complications, we may decide that early birth is going to be the best outcome for mum and baby. So there are general complications associated with a preterm birth, such as stay in the NICU. Sometimes there can be breathing issues with baby, general issues with low birth weight and feeding. But again, women and babies are closely monitored after having preeclampsia and exposure to it. So a lot of these early risks can be mitigated. In the more long term, there's still a lot of developing research in this area, just seeing how, I guess, exposure to preeclampsia as a baby, as a fetus, can impact you in the long term. But there is some evidence to say that children may have a higher risk of cardiovascular disease themselves, and some neurological and neurodevelopmental conditions such as autism spectrum disorder and ADHD. However, a lot of these we're still trying to work out, is this more due to the general lifestyle surrounding the child or in preeclampsia itself? And I guess the best thing that kind of leads on into the next question, Heike, about what can you do as a parent and a family to sort of reduce all of those risks associated with preeclampsia, is in the pregnancy, all those close monitoring and the management of the blood pressure, as everyone has mentioned before. Also, once the baby's born, regular follow-up with a paediatrician and the GP, and close monitoring of childhood growth outcomes like height and weight and BMI as the kids get greater than 2. And I guess just a bit more of having closer monitoring of developmental outcomes and things like that, especially as they reach school age, and just encouraging things like a healthy lifestyle for mum and baby as well, because things like breastfeeding and having a good diet once they can tolerate solid foods, these are all really, really important factors that will mitigate a majority of the potential genetic risks associated with preeclampsia.
And I guess for the parents to look after their own health, you mentioned
absolutely,
diet, but also attending their own medical appointments. We often have such focus on the children, right? That don't forget yourselves as parents in that.
Absolutely.
Yeah. Thank you.
Okay.
Thank you. Now, questions. These next ones are a bit more about the long-term health journey after hypertensive disorders of pregnancy, and which preeclampsia is part of. When I leave the hospital, how will my GP know what to do for my ongoing health checks going forward? Amanda, would you like to
Me? Yeah. So as you very well know, Heike, this is an area that we're trying to work on in terms of improving the care. Heike and I actually have a PhD student together, Jenny, who is looking into improving the postpartum sort of hospital to primary care transitions and the longer term follow-up. But again, I know I've banged on a lot about SOMAT's guidelines, but the Obstetric Medicine Society guidelines released earlier this year have a whole chapter on postpartum care, both sort of short and long term. And so initially, the recommendation is that you see your GP in the first week after leaving hospital, and your GP should have a discharge summary received from the hospital. We know that is not always getting to them by electronic and postal means as it should. So if you're given the discharge summary when you go home, please make sure you take it when you see the GP in case they haven't gotten something directly from the hospital themselves. And then there's obviously, they'll monitor that blood pressure, as Priya said, by about that sort of 6-week or so mark. Hopefully the blood pressure is back to normal and you're off all medications when you're having your kind of general 6-week check. And then at 3 to 6 months after giving birth, then you should have the sort of the general overall check, looking at your various risk factors and then all the kind of adopting a healthy lifestyle. And really yearly monitoring in terms of checking that you haven't developed high blood pressure, not getting high blood sugars, etc. from that point on.
Thank you. To one of the consumers, mums on the panel, as a mum having experienced preeclampsia during pregnancy, what was your experience when leaving the hospital and linking in with your GP or your healthcare providers back in the community? Siphiwe, what's your perspective? What's your story, if you'd like to share?
Definitely. I had different experiences. I'll share the positive one, which was with my second bab. And I think one, I received incredible care. And I remember when I was discharged, I was still attending the hospital outpatient GP. So I had to attend that for, I think it was 3 weeks. And they monitored me because I was on quite a few blood pressure medications. So monitoring that until they were comfortable. Then I was then referred to my community GP, and I had a hard copy of my discharge summary, as well as emailing that through to my community GP. And I was really fortunate that my GP's been amazing and monitored me through gradually taking off my meds, because when they attempted at first, I spiked a bit. So I think it was 3 months it took for me to actually gradually come off all the meds that they had and for my blood pressure to normalize. But it was that I found that the transition was pretty good from the outpatient GP to my community doctor who monitored me throughout as well. So I think it helps that you also have a good relationship with your GP. I found that she was also concerned about my mental health, how I was coping. She was asked me about my community support. What community support did I have around to ensure that I got that as well? So she was more concerned, like holistic care. And just like Amanda said, if you get that hard copy, if you can, I imagine now maybe some systems are more linked. I don't know how their systems are. Hopefully they are. But if you can get that hard copy, take it with you and take it to your GP as just as your way of just also due diligence, I guess. But I have one, so yeah. So I found I had a good experience with my GP.
Okay, thank you for sharing that. Heike, if I could just jump in.
Yeah.
On the note of discharge summaries, the junior doctors work very hard to write really detailed ones, so please feel free to always ask the nursing staff to print off an extra spare copy. It's very easy and it's your discharge summary, and you're entitled to have as many copies as you need. So they're very useful. Take them to your specialist appointments and your GP appointments, and keep a physical copy with you at home as well.
Yeah, thank you. Yeah, it is important just in case it doesn't get to the GP sometimes. Yep, that could be very useful. Good to come from both angles. Next question, I'll direct to Amanda. If you've had preeclampsia, does it mean that when I reach menopause that I'm at higher risk of heart disease?
So yes, I mean the shorter answer is yes. Having had preeclampsia means that you're at higher risk of various chronic diseases, including heart disease. Risk is not destiny, and all those sort of follow-ups are recommended in terms of catching signs that can lead to heart disease, such as chronic high blood pressure or type 2 diabetes early. But I think it's also important to say that it's not just when I reach menopause am I at high risk of heart disease. The increased chance is actually present from within 5 to 10 years after an affected pregnancy. Now, of course, because premenopausal women, it's reasonably uncommon to have heart disease. The absolute chance is still really quite low. But in terms of, an increased chance relative to women who have not had blood pressure problems in pregnancy, yes, that is present from early on. So the adopting a healthy lifestyle and, if things like chronic high blood pressure are diagnosed, making sure that's kept under good control is really important to minimize your risks and maximize your long-term health, not just once you hit menopause, but right from, having had baby.
Okay, thank you. Next sort of set of questions is more about, a few of you have mentioned this or alluded to the mental health aspect of experiencing preeclampsia and also seeking support. Dealing with a preemie baby and the scare of a preeclampsia diagnosis at 33 weeks with a few nights in ICU for me and NICU for my baby. For a few weeks was so stressful. I feel so overwhelmed and I didn't know where to go for some help initially. Have you got some suggestions for new parents, mums like me? Where can we find support? Siphiwe, would you like to answer that, and maybe Lynne can contribute too? Thank you.
I'm happy to.
Sure. You can go ahead first. You can go first.
The first thing I'll say to the person who wrote this question is that it's very, very normal to feel overwhelmed with what's gone on. And probably the biggest message or help I could give is to be kind to yourself. During this period, it can take a long time to process what has happened and sort of take it on board and be able to move forward with it. And from my experience working with women who've had preeclampsia, this can sometimes, for some women, it takes a week, a month, a year. Sometimes women are still struggling to process what happened 1 or 2 years after the event. So looking for support's really a good thing. Obviously, the first thing is family and friends. And it's not only emotional support, especially when your baby's in the nursery. It could be support like them dropping off a casserole at your front door one day, or someone coming around and helping you mop your floors or something like that. So you're very fortunate if you've got a good network of family and friends. Outside of that, to find information, I suggest AAPEC, of course. We do have a lot of information on our website that will support you. There's also other organisations like COPE, which is for mental health, the Centre of Perinatal Excellence. They have a lovely website with some information. You can contact them there. For preterm babies, there's an organisation called Miracle Babies who offer support to parents and families who have had a preterm baby. There's also SANS, which is for the stillbirth and neonatal death support services. So there's lots of online help you can get there. But moving on, I know a lot of women form friendship groups with other mums from the NICU. They have a preterm baby in common, and they just form this friendship, and a lot of them have long-term friendships and go off to mother's group together or play group together and socialize that way together. It can often be hard getting into a play group, especially if your child was very preterm, and if the play group's sort of organized around your children's age and your baby might be months behind that development. It can be a bit disheartening to see that your child's not doing what the other children are at playgroup, but it's still really important for you to be out socializing with other mums and for your child to be socializing as well. And I guess if you are concerned about your mental health, of course, talk to your family and friends, but then your GP would be your first point of contact for some help there, and maybe referral onto a psychologist if needed. So it's probably my tips. I'm not sure if Siphiwe can add anything.
Yeah. Anything else you'd like to add?
Lynne was amazing. She said a lot, and it's just pretty much just, yeah. I was overwhelmed, especially with my first baby, and I think, like Lynne said, even when I was being told I had preeclampsia, I think it was my husband who was getting all the information, because I was in shock more than actually receiving all that information. So everything was, I think I just coasted through everything, because every day was information overload, what's happening, and it didn't click to me. And I actually only got more information when I was ready for baby number 2. That's when I was now looking for support, and how am I going to prepare myself, letting my husband and my friends and community know, guys, when my face starts looking like this, so things like this, I was prepared for my second. But I think just emphasizing as well, community, use your community around you. I had my baby in NICU, and as I was also in ICU, and it was hard living bub in NICU and being at home. And so having people drop meals, I had a community dropping meals, was good, because then I could concentrate on, milk production and going to the hospital and not worry about cooking and everything. So even small things like that. And yeah, and just give yourself grace as well. Because it's a lot going on. And I think, like Lynne said, we now have AAPEC, there's a lot of information out there. And yeah, making friends with mums in NICU, you'll be amazed at how you're both going through something. And I did that as well. So not being shy, if it's in the lunchroom when you're making something to eat, to just have a chat, and building that community around you. And mental health, I think, personally, it was only with my second that I actually took time to go talk to someone, because I felt like, sometimes we as women, we want to be strong, I find, and carry on mom thing, work and everything. But I think when you get the chance and you need to just talk and actually go through, because it is in a way trauma, to just take care of yourself in that as well. There's no harm in having a good cry or finding someone to actually talk about what you've been through, because you want to look after yourself as well. So talking to your GP, and utilize your friends and family as well. Yeah.
Thank you. Some great tips there. Thank you. Lynne, I've got a couple of questions I'll direct to you. Got a couple more minutes. Let's talk about APEC. And being the president seemed to be the perfect person to answer these things. So what is APEC doing about raising awareness in the community, and how can people, whether it's members or family, be part of APEC to help promote information?
Yep. Heike, you mentioned in your introduction that one of APEC's objectives is to raise awareness out there in the community. It's an ongoing job that we try to do, and we still find many women who, when they're diagnosed with preeclampsia, that's the first time they've ever heard of it in their life. So it's a tough job that we've taken on, but we do try our best. We try to raise awareness through several means. One is our social media platforms that Priya manages. So we do have pages on Facebook, Instagram, and Twitter, where we post quite regularly now with some information. There's also a lot of information on the website. Having these webinars that we do run the 3 webinars every year. And it's another way of trying to get people to register and come along and help us raise awareness to the community out there. This year, we've taken an extra step, and we had a sponsor stall at the big SOMANS conference that was on in Sydney last month. So we had all our banners up and our merchandise, pens, Post-its, phone wallets, and we gave away our brochures, and we advertised this webinar. And that was to really try and raise awareness of APEC amongst health professional conference. So a little bit different to raising awareness of preeclampsia in the community. Probably the biggest thing we do every year is our walk. That's always around World Preeclampsia Day, May 22. It's our main fundraising event for the year, and we do try to have people walking all around Australia. We haven't quite got there yet. This year we had organised walks in Sydney, Melbourne, Gold Coast, Perth, and Adelaide. And next year we're hoping to have another 1 or 2. So the second part of your question, Heike, was about what people can do.
Yeah, how can they engage?
So the first thing to do is to become a member, support APEC, and sign up. It's really easy to do on our website, which is just apec.org.au. You can contact us through our website if you want to help us organise a walk somewhere around the country, or you might have some skills that you're happy to offer. We are a charity. We are busy working volunteers, so we appreciate anyone who comes along with a skill. We're actually looking for an animator at the moment, so put a call out there now to see if we can find someone. The other thing, if you have an opportunity to help us distribute our brochure wider around the country, that would be terrific too. Other things you can do is, which will be helpful for you as well, is to write your story down. And we do have some stories on our website. So if you're happy to write your story, we'd be more than happy to pop it on our website. Cammie's just put our brochure up for everybody to see. It's double-sided, so that's one side of it. Oh, there's the other. So it's a great little brochure explaining what APEC is, what preeclampsia is, and the short and long-term risks, and some support contacts there as well. Probably the last thing I can think of is put your hand up to get involved in one of these webinars. I mean, Siphiwe's stories and her insight has just been beautiful tonight. And that's really valuable to hear from people with a real story to tell. So we're more than happy to have people on our webinars to come along and help.
Absolutely.
Yeah, I've just sent, there was a question from the Q&A. Would you like me to read it out? It was addressed to Prof. Henry. So, advanced maternal age is considered as a known risk factor for preeclampsia and stillbirth. What are the current management strategies in Australia for AMA-specific pregnancy complications? For example, apart from advice on maintaining a healthy lifestyle, close monitoring of pregnancy, are there medications such as aspirin administered to improve both maternal and fetal outcomes in these advanced maternal age pregnancies?
So in the absence of other things, we wouldn't generally recommend aspirin for just older maternal age alone. However, if for example, it's your first pregnancy at an older age, then those will be kind of two moderate risk factors and therefore would classify as, yes, we would, recommend aspirin. And as for everybody, exercise is a good idea and check the dietary calcium. And look, late maternal age may obviously also be associated with some of the other risk factors, such as IV needing fertility treatment to IVF to conceive. And so yes, women who are coming into pregnancy older, may well meet criteria for those pillars of prevention, and often will have extra growth scans for baby as well, because of those risks. But it's look, most women of older age will still do very well. We beat ourselves up about later maternal age as a risk factor, but actually separate from the other things that may go along with later maternal age, just being a bit older actually is not, that much of an independent risk factor. So yeah.
Okay. Thank you. I think in the interest of time, we've got 3 minutes left. I want to keep this to the time we've planned. I would like to invite any questions to please be directed to our info@email. You can find that on our website. We can continue answering your questions if something pops up or you're watching this later on. Please direct your questions to our website and we will get back to you. I'd like to really thank our panelists today and all attending today's webinar and watching this in the future. We hope to see you again soon for one of our future webinars. And just to close off, I'd like to ask Cami to put up, we've got a little feedback slide. We'd like to collect some feedback from you today if you've attended, and let us know how you felt about today's webinar, about the content, and what there might be in the future, what you'd like to a webinar to address. So you can just scan the QR code here, and it literally will be it's a 1-minute survey. It won't take you long to do. We really, really appreciate your support. And again, to our panelists, Lynne, Amanda, Siphiwe, and also Priya, thank you so much. Cami, thanks for all the admin support. And yeah, wishing everyone a lovely evening. And yeah, please leave us some feedback. Thank you.